So I was standing on the banks of a swiftly flowing river when I heard the cry,
"Drowning man!"
I jumped into the cold water and I swam forcefully against the current and made my way to the struggling man. I grabbed him, I pulled him to the shore, I laid him on the banks of the river, I applied artificial respiration in order to revive him, and just as he began to breathe, I heard another cry for help. So I jumped back into the cold water, and again, struggling against the strong current, I made my way to the struggling woman. I grabbed on hard, I pulled her to the shore, I laid her on the banks of the river, and I applied artificial respiration, and just as she began to breathe, I heard another cry for help. So I jumped back into the cold water. I swam against the current, and I'm getting tired now. But I do make it to the person, and I grab the struggling man, I pull him to the shore, I lay him on the banks of the river, I apply artificial respiration, and just as he begins to breathe, yep, I heard another cry for help. Near exhaustion, it occurred to me that I was so darn busy jumping into the water, grabbing hold of these folks, pulling them to the shore, applying artificial respiration, that I had no time to take a look upstream and see who's pushing them in. Well, you know, this metaphor tells a story beautifully and yet tragically of the American approach to healthcare. In short, we're so darn busy downstream pulling bodies out that we lack the time, the energy, and even the will to go upstream, figure out who's throwing them in, and tell them to stop it. But you know, as I've thought about that metaphor, the other thing I know is that fixing healthcare won't fix healthcare. And the more I've thought about that metaphor and all the tributaries that are along it, what we tend to think is that there's some one space way upstream, just this one space that holds all the answers. But in fact, I think there are multiple tributaries all along that river that provide opportunities for us to intervene and stem the tide of lives that are actually entering our healthcare system. So we invite you to take a walk with us along our imaginary river, and let's explore some of those tributaries and the opportunities they provide to intervene. Well, actually, the first place along our river that we come to is the healthcare system, because we do need a system that's functional. We need to be assured that it's not going to harm us, and that we stand a pretty darn good chance that it won't bankrupt us. And currently today, that's not the case. It's expensive. We spent $2.7 trillion in 2012 on healthcare. And we ranked dead last when compared to 6 other industrialized nations when it came to system performance. Hundreds of thousands of people are harmed by our system, and tens of thousands of people are actually killed by our system when they come into our walls of healing because of how we operate, or not. And very few of us would give our system every time a letter grade A based on our care experiences. You know, America needs a system that's safe, that's timely, that's effective, that's efficient, that's equitable, and most importantly, that's patient-centered. And currently, that's not consistently the case, although lots of folks around the country and even in our own community are working on this. But you know what? Even if we did have a system that worked perfectly, that didn't harm us and didn't bankrupt us, all that assures is that we won't do those things when you enter our doors. So what else can we do? Well, let's keep exploring. You know, the second place that we come to, the second tributary that's of importance that we come to, is the whole idea of the timely prevention of use of clinical prevention. Do you know that 3/4 of our healthcare dollars are focused on preventable chronic conditions, and yet only 3% of the trillions of dollars that we're spending annually in this country are focused on protecting health and of preventing illness and injury? Just using 9 clinical preventive services could result in up to 50 to 100,000 avoidable deaths annually in our country. Half of us aren't even receiving recommended preventive services. 50% of the people in this country with high blood pressure are not in control. And sadly, people living with diabetes, 30 to 50% of them are in poor control. You know what? We can do better than this. We can. And that takes us to the next place on the river, the so-called space of personal responsibility. Yep, yeah, I hear you. Personal responsibility. There's a relationship between the 12 leading causes of death in this country and our lifestyle choices. But there's not a topic that engenders more emotion than this whole notion of personal responsibility for my behavior, especially when it comes to obesity prevention. Is it my responsibility to change? Or am I a victim of circumstances and society needs to change? Well, whatever end of this spectrum you come out on in terms of this kind of binary either-or way of thinking, the fact is that our lifestyle changes are adding unnecessary cost to the healthcare system. It's robbing us of our ability to be our best at home and at work, and it's cutting short far too many lives. So what else is upriver? Well, let's just keep walking. And that brings us to this place called healthy environments. Our environments are literally making us sick, either because of things as basic as the quality of our air and water, or the status of our infrastructure. And then there's the so-called HEAL activities, that is, healthy eating and active living. You know, all of these, addressing all these issues are laudable goals, and a ton of stuff gets in the way of actually being able to deal with it. Do you live in a place with clean air and water? Are your neighborhoods walkable and bikeable? Do you feel unsafe because of violence? Do you have to shop for your food in corner convenience stores or liquor stores? Are healthy food options available and affordable? And since we know that your zip code matters when it comes to health outcomes, what are we doing? What are we doing to work? And what's our responsibility to work on improving our communities? Well, the one thing we do know is that focusing on this work is incredibly important, and yet a lot of stuff gets in the way. And that brings us to the next space on our river, the so-called social determinants of health. Well, the social determinants are those conditions into which we're born, grow up, live, and age, and the structures we put in place to deal with illness. And then all of those things are shaped by a wider set of forces: economics, our social policies, and actually even politics. And the critical ones include race and ethnicity, education, and economic self-sufficiency. And while that's important and it affects everyone, this is particularly important for women. And they're all also very much intertwined. So let's just look at one of them, education. A child born to an educated mother is twice as likely to reach his 5th birthday. Educated mothers are 50% more likely to immunize their children. And a girl armed with just a basic education is 3 times less likely to contract HIV and AIDS. I'm going to tell you something. We can do better than this. We absolutely can do better than this. And that takes us, when we think about these darn social determinants, to another space. Because how do we not lose hope? Where do we even begin? And so I'm here to tell you that maybe there's another space. What if there's another space way, way upstream on that river? And in fact, at the headwaters of every single one of those tributaries. And what if in this space and in all over this country there are beacons? There are beacons of light that could shed light on what are the foundational elements that are required to build healthy communities and healthy societies. Wherein the healthcare system, it's there when you need it, and only when you need it. Well, that place, that space, it's all about community. It's all about being connected to each other, to responding to adversity in ways that ensure that we're going to come out on the other side smarter and stronger than we were before, that we're building up a set of assets that enable us to live our best lives. And in this place, health is an enabler of living. It's not the end goal. In this space, we don't view health as the absence of illness, rather that sweet space wherein we can live our best lives. In this space, we're in relationship with each other. We're connected to each other. We care about one another. In short, we love one another. And there are people all over this world, and in fact this country, that get it. Dr. Don Berwick gets it. Dr. Berwick started the Institute for Healthcare Improvement, and this organization is transforming how healthcare is delivered all over this nation. And yeah, there's measurement, and there's protocols, and he standardizes processes. But what Dr. Berwick got when he started this institute is that it was all about building healthcare teams. It was about learning from our mistakes, and it was about leaning into the discomfort of interdependence, because we knew when we did, we get better outcomes. There are communities in Nigeria, Uganda, and Tanzania that get it. In these small villages that are extremely impoverished, people living with HIV/AIDS are complying with their medication regimens better than we are in this continent. They're getting over 90% compliance with treatment. And it's all because the community and the care providers have set the expectation that people with this disease are going to take their medication because they're important to the whole community. And if they don't take their meds, however are they going to take care of their families? It's all about lifting up the value of social relationships in order to stem the tide of a disease that's decimating a continent. Arthur gets it. This YouTube video has had over 9 million hits, and it chronicles the story of a veteran as he made his transformation from a man who had to walk with ankle braces and crutches back to his confident, completely independent, and very fit self. And there are people all over this nation that wake up some morning and say, you know what? It does start with me. I have to do it alone. I have to do it myself, and I can't do it alone. And when they make that determination, the cheering squads come out all in force to support them. Our own North Middle School gets it. This school has made a decision to plant a community garden, and it brings the community together. Folks get a little bit of physical education, they learn a little science, a little math, and this fall they're going to have their first farmer's market, and they're going to sell their produce. And Jeffrey Canada gets it. His Harlem Children's Zone is a model for this nation. 100% of those kids graduate from high school and go on to a secondary education. And while his teams are creating places and spaces for kids to learn, they're also meeting basic human needs because they understand that the social and the economic returns on that are huge. I could tell you a whole bunch more stories, but we don't have time. But what I will tell you is that all these stories are about connection, they're about resilience, and they're about building up social capital. I'm going to tell y'all something. It's instinctive to rush into a river when somebody's drowning and try to save their life. And in American healthcare, we've created a set of values and a culture that completely reinforces this very basic human instinct. As a physician, when I save a life, I'm deemed a hero. You guys pay me handsomely for it. And I get an incredible, gratifying feeling to be in people's lives at this most vulnerable time, in this most sacred of ways. But I believe that there's another instinct that's way more basic and way more primal than that. And that's the instinct to be connected to each other, to be in relationship with each other, and to celebrate our interdependence. And when we do this, we end up building up this cachet of assets that actually positively improves what we see downstream in terms of health and health care. Eric Kleinenberg wrote an article in the January 7th issue of the New Yorker magazine called Adaptation, in which he said, improving our community's infrastructures is necessary, but hardly sufficient in order to reduce the amount of death and destruction that comes from any one of a number of natural disasters. And he went on to talk about the Chicago heat wave of 1995, in which 739 people perished. He tells a story of these two communities, African-American communities, that sit right next to each other. And for all intents and purposes, they look exactly the same. Same levels of violence, same amount of poverty, and the same number of elderly. In one community, the death rate per 100,000 people was 333. In the adjacent community, it was 3. The difference? Cohesion. People were connected to each other. They knew their neighbors, and they were checking in on people. And so when I read this, there was this moment where I stopped, and I reflected on my own life. My family lives in one of the more affluent neighborhoods in the Front Range, and I barely know my neighbors. If I were to die when my husband were out of town, how long would it take before anybody even knew it? And what if there was an opportunity to have made a difference, to have saved my life, if I were differently or better connected to my neighbors? And far worse, as a physician, what if the same was happening in one of their homes and I was powerless to do anything about it because I wasn't connected and didn't know? And so you know what? I have a call to action for you and for all of us. If you imagine our imaginary river, go back to our imaginary river, and you think of all of those tributaries, there's a place that every single one of us either live, learn, work, play, or pray. And we have a responsibility in every one of those places to build community. Because until or unless we do, healthcare is going to remain broken. And fixing healthcare, sorry, it won't fix healthcare. Thanks.